In the fourth section, now we will talk about the cochlear implants. Cochlea is in the inner ear, and that's the final step from where the sound goes to the auditory nerve in the normal hearing individual. So once the implant is in the cochlea, then it bypasses all these steps of the passing of the sound from the external ear, then the middle ear. So cochlear implants is then there is a direct connection from the internal ear or the inner ear to the auditory cortex or the brainstem. So we will talk about what are the different components of the cochlear implants, how it function, and who are the individuals in which cochlear implants should be performed. Then what are the outcomes of the procedure and evaluation of the patient. Then we will talk about the surgery performed and how mapping can be done, and what are the complications of the procedure. So all this we will talk about in this section now. So first, how cochlear implants they function. The electronic device that can provide hearing and improved communication ability for sensory neural hearing loss patient who cannot benefit from hearing aids. So very, very important, sensory neural hearing loss only. People who have sensory neural hearing loss, they can benefit it from the cochlear implants because it's an electronic device that can provide hearing and improve communication abilities. So important type of rehabilitation for hearing impaired individual. So if you see the diagram, this is the internal implant. So it's implanted internally, and then its electrodes are placed on the cochlea. So this is the cochlear implant, hearing nerve, and then we have the sound processor, which is internal implant, implanted internally. Nothing is on the surface or outside. The components of the cochlear implants, there are external components, which is the speech processor and transmitter, which is body worn or behind the ear tribe. And then we have internal components which are surgically implanted receiver stimulator package with an electrode array. So this is the electrode array. And then this is the external component. We have the transmitter and the speech microphone and the speech processor. Functioning sound is picked up by the microphone in the speech processor. Then we have analyzes and code the sound into electrical pulses. Then it delivers meaningful speech parameters from the acoustic stimulus to the nerve. From the nerve now, electrical impulses are sent from the processor to the transmitting coil, send the signal to the surgically implanted receiver via radio frequency, and then receiver stimulator decodes the signal and transmit it to the electrode array in scala vest tympani of the cochlea. From there, it stimulates the spiral ganglion cells. Auditory nerve is stimulated and send these electrical pulses to the brain. So all these are the different steps how the functioning of the cochlear implants occur. The sound is picked up by the microprocessor, speech processor. It analyzes the sound, send the electrical pulses, that cause mobility in the cells present in the transmitting coil, and then slowly all these process to the auditory nerve, and then sound is transmitted to the brain from the cochlea. So this is the functioning of the cochlear implant. Next candidacy profile is for bilateral severe to profound sensory hearing loss. So this type of hearing cochlear implants is mainly for the sensory neural type of hearing loss, can be unilateral or bilateral also. So bilateral severe hearing loss. Little or no benefit from the hearing aids. If they tried hearing aids again and again, different types, nothing benefits, then they should go for the cochlear implants. No medical contraindication for surgery. Realistic expectation. Expectations should be realistic. It's a surgical procedure is performed. Usually patient expect that they will start hearing everything and it will be 100%, but their expectations should be realistic. They can, it helps to improve the hearing and communication gets better, but it's not like 100% or too much expectations are not good. Good family and social support toward rehabilitation is important, and adequate cognitive function is also important for the use of device. So this is very important that the expectations should be low, and they should have a good rehabilitation and support from the family, because because family is the one who is dealing with them all the time. They need to support and help the individual, and then they should back up so they can feel better. Outcomes, usually there depends on the outcomes of cochlear implant, depend on if there is previous auditory experience, if the patient is post-lingual patient or prior use of hearing aids. Younger age at implantation, prelingual children. So again, outcome depends on the prelingual or postlingual that affects the outcome of the treatment. Shorter duration of deafness, it helps better if it's the shorter duration of the deafness. Again, this is the diagram that's showing the cochlear implant external component, then the internal components. Electrode era is attached to the cochlea. Neural plasticity within the auditory system. Very important again for the outcome of the procedure. Neural plasticity means if the auditory system has the ability to grow the cells, form the cells, that plays an important role. How bad is the damage that affects the outcome of the cochlear implants. Evaluation, pure tone audiogram, these are all the tests done to evaluate the patient after the surgical procedure to find out how effective was the procedure or the surgery. Pure tone audiogram, speech discrimination test, tympanometry, autoacoustic emissions, then auditory brainstem response, auditory steady state responses, hearing aid trial. So evaluation should be performed to find out how much it helped the individual, what was the test evaluation before the procedure, what's the evaluation after the procedure, or how much degree it helped. Speech and language evaluation and psychological evaluations. All these evaluations should be performed after the procedure. Surgery: place the electrode array within the scala tympani of the cochlea. So this is the, we have the implant, headphones, implant, these are the electrodes, and electrode array are placed in the scala tympani of the cochlea. Here these electrodes come down and in the scala tympani. Facial recess, two types of approaches mainly used. One is from the facial recess, other is pericanal, viria and suprameatal recess approach. So these are the two surgical approaches from which the electrodes are placed. We have through the facial recess approach and then viria and suprameatal recess approach. Post-operative mapping, programming of device. Activation is usually 3 to 4 weeks after implantation. Don't activate the equipment right away. It needs 3 to 4 weeks after implantation for activation, so it gets fixed in after the surgery. Programmed or mapped on regular basis during post-operative rehabilitation to fine-tune the processor. So regular mapping is required after the procedure, so it gets acclimatized with the surroundings, gets used to the surroundings to fine-tune the processor. Habilitation, in which the most important we have auditory verbal therapy, so they can hear and speak what they hear, so that's important, auditory verbal therapy. Complications, early complications, we have facial paralysis, especially we use the facial recess for the approach where the facial nerve is there. Any damage or injury can cause facial paralysis. Wound infection, as with any surgical procedure, wound dehiscence, opening of the wound edges, again common with all the procedures if it's not properly. Flap necrosis, electrode migration, device failure, cerebrospinal fluid leak, meningitis, post-operative dizziness, vertigo. So all these are the early complications of the cochlear implants. Meningitis can occur with the inflammation of the meninges. There is dizziness and vertigo. Now, late complications, we have exposure of device and extrusion, pain at the site of implant, migration, displacement of device, late device failure. These are all the complications that are not immediate complications, but after period of use, these can occur. So the patient should be aware of all these complications. Then otitis media is also present. So that was all about this section 4. Thank you for watching sqadia.com.